Hi, I'm just here to talk about breast cancer. Breast cancer is actually the most common cancer in women today, and it's about 52,000 women are diagnosed with breast cancer every year in the UK. About 400 men, so men do get it as well. The best tool we've got for survival is to get it as early as possible. And the best tools we can do to help that is to check, so breast awareness, make sure you know what's normal for you, and any changes report them to the GP. The other one is breast screening. So we invite ladies every 3 years, and we can then detect things that are smaller than you can actually feel. So the breast awareness and the breast screening go hand in hand together. So it is sort of anxious for the ladies when they come the first time for breast screening. So we've actually put together a pathway of a lady coming for her first screen, and here it is.
Jane Doe, hello. Would you like to come through to the office? We can get you booked in. Take a seat. How are you today? Mrs. Doe?
Yes.
Hello, would you like to come this way?
Thank you.
Hello, how are you? All right? Okay, if you'd like to come through. Thank you. If you'd like to come take a seat on the chair. And your name's Jane, and my name's Sarah, and I'll be doing your x-rays today. If I could just check your name, address and date of birth, please. I'm going to be doing 4 pictures today. That's 2 on each breast in 2 different positions, and the reason we do it in 2 different positions is so that we can see the breast on 2 different planes. It's not a painful procedure, but it is a little uncomfortable, and that's because we have to apply a tight pressure to the breast just before each picture is taken. Now, it's not on there for very long, but it is a very important part of the procedure. The reason we do that is so that it holds the breast very still, so we don't get any blurring and have nice, crisp, clear diagnostic images. The other reason is so that it thins the breast tissue out, so it's less radiation given to you. So what I'd like you to do now, Jane, is just to undress to the waist for me. I'll go and get all your details up onto the computer screen, and I'll explain everything as we go along. Okay. Now before we start, I'd just like to do a quick visual examination, and that's so that I can look for any scars, any moles and any asymmetry of the breast. So if you'd like to lift your hands really high, bring your hands tight together, push tight, and then bring the hands down onto the hips. Good, that looks absolutely fine. So if you'd like to come and face the machine. Step to the right, that's right. I'm going to start with the left breast, which I will lift. I do have to touch you to position you, and you're happy for me to do that?
Yes.
So I'm going to lift the breast first and just twist you slightly. Turn your head to the right and just lean forward into the machine and keep those shoulders nice and relaxed. I'm going to bring that pressure down now, and it will be firm, but it's not for very long. Keep very steady there, don't move. Okay, well done. If you'd just like to step back and relax. I'm now going to do the side-to-side picture. And this is where we look underneath the armpit at your lymph glands. So if you'd like to step forward, put your left hand on the top, put your feet slightly apart, to just lift the breast out. Keep nice and steady. I'm just checking under the armpit, and rest your hand down. Nice and relaxed. Bring that pressure down. Nice and steady there. Well done. Very still for me. Well done, all finished. So if you'd like to get dressed, and we will be sending you your results letter to you directly within the next couple of weeks. Okay? Thank you. Do you have any questions before you leave?
Yes, does my doctor get a copy of those results?
Yes, the doctor will get a copy for your records at the surgery, and if we do need to call you back for a further investigation, we'll ask you to come back here to the screening centre, and there will be an appointment in your letter. Okay? So if you'd like to come this way. Thank you.